Hey everyone, Luke Margolis, Corporate Communications Director for Atlantic Health System, and today I'm joined by the Senior Vice President, Physician Enterprise, and the President of Atlantic Medical Group here at Atlantic Health System, Dr. Stephen Sherris. Dr. Sherris, thanks for joining us.
Thanks, Luke.
So today's news, I'm sure, is raising a lot of questions amongst folks about, how does the J&J vaccine fit in the broader context of our vaccination program? What does this news mean? What was your initial reaction to what we've heard today, and what do you think folks need to know?
First a little context, for 3.5 months worldwide, been rolling out these vaccines. Also here at Atlantic Health System and in New Jersey more broadly. Now hundreds of millions of vaccines given worldwide, tens of millions in the United States, hundreds of thousands here at Atlantic, literally. It's pretty much gone better than expected, but today's news not unexpected. For any new medication, vaccine that comes out, whether it's under emergency use or through the full FDA approval process, you're going to see some side effects once it gets out in the general population. We've seen some reports of thrombosis in Europe with the other vaccines. They've gone on pause while the European regulators have evaluated it to see whether the incidence of side effects have been greater than that of you would see with the general population unvaccinated, and they resumed the vaccination cadence in general. So this is part of good practice for the FDA. If they see something, they stop, they pause, they evaluate the data. For J&J, it's apparently 6 cases and 6.8 million vaccines, a very low incidence of thrombosis. What the FDA is going to do now is evaluate that against the background rate of thrombosis to see if that's the same or less than you would see in a vaccinated population. And if it is, they're going to resume it forthwith as soon as they can.
So ultimately, this is the process working as it's supposed to.
It's a safety process, and actually that should engender confidence in what the government's doing with the vaccine rollout. So I think in sum total, the assessment is the vaccines are safe, they're wildly effective. They're wildly effective at preventing severe disease, hospitalization, and most importantly, death.
With that in mind, if you want to learn more about our vaccination program here at Atlantic Health System, go to atlantichealth.org/COVID vaccine, where you can also sign up for appointment alerts. We are still administering Pfizer and Moderna, as Dr. Sherris has suggested, full speed ahead with those 2 vaccines as well. So Dr. Sherris, thank you so much for joining us today, and we'll see folks next time.
Yeah, one final point, if you have any symptoms, whether or not you think they're from the vaccine, from COVID, even if you have been vaccinated, you still may get a mild case of COVID, call your doctor. Talk to them. They're your best resource for evaluating your situation at any point in time.
Thanks, Dr. Sherris.